I am the face of heart disease.
Forget about that taboo that women are less prone to get the heart disease.
The morning that I had the heart attack, that weekend, I had moved all the furniture in my home. I had gone for a walk. I had done 40 minutes of aerobics, which I did every other day, about 3 times a week. I went to work on Monday, and I just felt a little different. I knew something was happening in my body, but I wasn't exactly for sure what it was.
In case of Mrs. Enrique, Mary Nell Enrique, she's a 65-year-old patient, never had a heart problem, no high blood pressure, anything. And one of the days she started having some jaw aching pain, the left upper chest aching pain, a headache.
At 4 o'clock in the morning, I woke up. I was real restless. I didn't know what was going on, but something was going on in my body. It was something, I couldn't explain it because I didn't have pain. I wasn't dizzy, lightheaded, nothing like that.
They always come in with I thought. Just a very good example today. Patients had no coronary artery disease. She had a heart attack about a year ago.
He said, so you just had no symptoms, no signs, and yet I had a heart attack because it was a gene that I inherited from my dad. And I was the first female in our family to have a heart attack.
And being a Hispanic female, I thought, well, we get diabetes, we get, high blood pressure, but I thought, we don't die of heart attacks,
My message to the patients is always talk to your doctors. And it's our job to find out, like the detective, we have to ask a detailed history.
I didn't realize I was having a heart attack until my jaw started hurting. And he said, your jaw can hurt, your lower back is an indication, your elbow could be hurting and you think it's bursitis, and that's an indication. The shoulders, he said, that's an indication. And all of those things, I had no clue.
So the husband was very good, and he waited no time, and he encouraged his wife got to go and check out in the ER, which they did.
I never was a smoker. I never drank. And so, he said, you're just a classic because you inherited your dad's genes, because you were doing everything right.
The bottom line of message is that pay attention to these symptoms, listen to the whole story, take the whole context before we jump into conclusion.
I think I've gotten accustomed to my diet. I know that that's what I need to do, and that's what I have. That's what I have just about every other day. I change it up. I do the Southbridge diet, and I know, the different phases and what I can have. And
do what is right for you, and enjoy your health as blessed by God. Otherwise, you can live long, but you will suffer, or you don't live long. You have to pay better price.